Between the gift shopping, the cooking, the prepping for guests or travel, you may not think too much about your heart health this time of year, but the American Heart Association says you really should.
Yeah, so according to a study by the organization, deaths caused by heart attacks spike during the winter holidays. We know that sounds pretty scary, which is why our 9 News medical expert, Dr. Payal Kohli, is with us this morning to explain the data and what you should know. Dr. Kohli, good morning.
Good morning.
Okay, let's talk about this AHA study. Talks about heart attacks during the holidays and the risk that people face. Can you elaborate more on what this is?
You know, it's a busy time of year for cardiologists, and that's because the deadly heart attacks, the ones that are likely to kill people, most common on Christmas Day,
Oh my gosh.
followed by the day after Christmas, the 26th, and then followed by New Year's Day. So if you think about it, what are we doing in our lives around the holidays that might be bringing on more deadly heart attacks? Well, the first one is our routines are all disrupted, right? We are eating more, we're drinking more, we're having more sodium, we're sleeping less. Second, you're at a holiday party or gathering and you feel a little something in your chest, most likely blow it off.
Right.
Heartburn.
Yeah.
I ate too much, I didn't sleep enough, it's probably nothing. Or even if you do think it might be something, you don't want to disrupt the gathering for everyone else, so you sort of keep going on. And then third, you think about our medications, our travel, all of that gets disrupted. So there are lots of reasons why this might be happening.
So scary and sad that it's like during Christmas and New Year's. So what can we do to reduce the risk?
Well, there's a lot we can do, in fact, and we should really be active in thinking about what we should do to reduce our risk. So the first, I would say, if you're a heart disease patient, you already have pre-existing heart disease, it's really very important to make sure you don't miss a single medication. And the second is to make sure you're trying not to disrupt too much of your routine, because that routine disruption can really sort of precipitate a lot of these issues. And then you want to make sure if you feel something, you seek care right away. I don't care if it's Christmas Eve, I don't care if it's Christmas Day. Knowing this data should really empower you to seek care right away.
Absolutely. What other kind of heart disease should we be mindful of this time of year?
You know, there's a condition called holiday heart, and we learned about it in medical school, and it happens most commonly around the holidays, but really can happen around Valentine's Day, around New Year's Eve as well. And it's really when we drink too much alcohol, it disrupts the electrical rhythm in our heart and creates a condition called atrial fibrillation. And, you know, people who tend to binge drink, meaning more than, 3 drinks for women and more than 4 drinks for men in one single setting, even if there's someone who drinks all year round, young, healthy people without necessarily having heart disease, they can go into this electrical disturbance, and it can be really disruptive and disturbing because you feel like you can't catch your breath, you get lightheaded, you get dizzy. So that's a condition called holiday heart. But aside from that, even just regular, all the other things we talked about, you can have electrolyte abnormalities, you can have, dehydration, all of these other things that happen around the holidays. Now, interestingly, they looked at cold weather and whether that may be a precipitant. And here in Denver, we're lucky it doesn't get that cold around the holidays. But even if you look in LA and you look in the southern hemisphere in New Zealand, where it's actually warm over the holidays, you see a lot of these same patterns. So we don't think it's the weather triggering inflammation. We think it's more our behaviors, which to me is a positive thing because it means that you can actually modify it.
Yeah. Well, it's really important that we know this information in advance.
Absolutely.
I feel like you're talking to so many people right now because they're so stressed.
Truly.
There's so much going on. There's a lot of disruptions to so many things in life. So this is really great reminders.
Well, and we know that heart disease is the #1 killer of men
Yes.
and women. So statistically, it's the most likely thing that's going to happen. So, the best thing we can give our family in terms of gifts is taking care of our
Absolutely.
health and making sure we focus on our heart.
And keeping that stress down as much as possible this time of
me
year. I know, I felt it too. Dr. Kohli, thank you very much. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli. Let's get a check of that forecast now with Chris.